Welcome back to Fox-11 News in Depth. I'm Hal Eisner, and as we move into another tier of vaccine availability, it's encouraging to realize that big inroads are being made. Nevertheless, it seems like the closer we move to the end zone, the more questions arise. And here to answer some of those questions is Dr. William Wang. He's the Chief Medical Officer at Dignity Health Glendale Memorial Hospital. He's in charge of the vaccination programs. And Dr. Wang, what do you currently view as the biggest obstacle to getting people vaccinated?
Fear is the biggest obstacle. The other thing is that there seems to be a 15 to 20% no-show rate. Sometimes the patients forget to come, and other times they might be sick. But fear is the biggest problem that we're noticing.
Now, anecdotally, I've been hearing that there are cases in which there are people who don't want to take the second shot. It's not for getting the second shot. Are you finding that to be true?
Yeah, actually, just today in our drive-through here at the Dignity Health Sports Park, I spoke with a couple of patients that said that the first reaction of having a fever and a little bit of chills, they show up here and they're like, I just don't want to go through it again. I try to explain to them, having gone now through 3 waves here in LA County and seeing the death that occurs, over 23,000 people here in LA County unnecessarily dying or passing away from this. It's worth the risk of having 2 or 3 days of uncomfortableness rather than passing away.
It is probably worth a second to just talk about why you get the chills or the fevers or the aches or the pains. And I just had my second shot. First one went like a breeze, didn't even know the needle went in. But the second one, I had a little bit of chill, a little bit of ache, a little soreness in the arm. Nothing major. It was minor compared to some of my friends, one of whom ended up in the hospital for a weekend. But the thing is that you're getting these effects, and tell me if I'm wrong. You're getting these effects because the first shot gives you little antibodies, and when the second shot comes in, the incoming is greeted by an army of little antibodies that are beating up on you, and that's why the body is reacting in the way it does. Do I have that right?
You have that right. The other thing that's really important to stress is that if you don't get a reaction the second time, that's okay too. We've had a number of people getting concerned saying, oh, I didn't get a reaction and did it not work? Everybody's different, and some people get the reaction, some people don't.
And some people are asking me questions and I can't answer because I'm not a doctor. I don't even play one on TV. But the thing is that there are people saying, well, after 3 months or 4 months, do I have to get another shot? Is it over? How long do the antibodies last? Why don't you fill us in on that for a second?
Yeah, so that's one of the things we don't know. We don't know how long the antibodies will last from this. We presume it's better than having COVID and having the COVID response. It lasts for about 90 days, the antibodies. We think that the vaccine lasts longer, but probably this is going to be something that on a yearly basis, we're going to need a booster.
Kind of like a flu shot. And with the vaccine eligibility now open to those with disabilities or underlying conditions, are people relying on the honor system? Doctors' notes aren't required, right?
That is correct. We are relying on the honor system. We're not checking. Just make sure that you bring your medical records with you to see if you meet all the criteria. If you meet criteria, come and get vaccinated.
One of the conversations I've been having with folks lately, even among friends, is the AstraZeneca vaccine. And this vaccine has been through all kinds of trials and exercises and drills, and yet the news that's coming out of Europe is not particularly good because it talks about blood clots, it talks about strokes. We know that some countries have temporarily halted the use of this vaccine, but we also know that the World Health Organization just came out and backed it. What is the situation with this vaccine? Why are there these concerns?
So the concern is that when you start a vaccination process and you have more people entered in to getting the vaccine, some of the more uncommon things get out, and then the media picks up on it, and then you start to see a trend that you may not have seen because the sample size on the original testing was not large enough. And so they're doing the right thing. They're taking a stop and just re-looking at the data to see is this associated with the vaccination or not.
One of the things that struck me personally as I was getting my shots was the paperwork that I read in advance of doing it that said this has not been approved by I had the Moderna, by the way. This has not been approved by the FDA. Obviously, it is not. It's been a federal emergency recommendation that it be approved for emergency use, but it's not been approved by the FDA. How are people to look at that when they read paperwork like that right before getting a shot?
Yeah, so this went through the same testing process as all vaccinations do. The big difference is that they went into production about the same time that they put in to get the permission to use the test, right? So that's the first thing. That's the part that was accelerated. The actual testing, safety, efficacy of this was not changed at all. And like everything happens in sequence, one little part was moved ahead. It's really important to know that it's as safe as any of the other vaccines that we've put out before.
All right, just 15 seconds. What's the bottom line?
The bottom line is please get vaccinated. Take any vaccine that you're offered. All 3 vaccines do the important thing. They prevent you from dying.
All right. Dr. William Wang, thanks so much for joining us. Appreciate it.